the Celebrate Led Advocacy webinar. This is the last webinar on the adolescent health and well-being. 100 people have registered for the series, and it's so exciting to see that so many people have had interest in the series and have also interactively engaged in them. So this is going to be an interactive dialogue that will showcase our youth advocates from 5 countries around the lessons and best practices from their work on youth-led advocacy. And so what we will be engaged on in this webinar, it will include on the toolkit, how it has been used at country level, and we'll also have some rapid fire with young people's experiences on advocacy country level, also include them addressing challenges. So in this webinar, we will also announce some of the opportunities for youth networks, particular countries, to engage in the scale up of the toolkit with funding and support from PMNCH. In the follow-up to the webinar, we will share a series of blogs and a video that highlights the journey with supporting young people to build coalitions and strengthen young people's capabilities and develop and implement advocacy roadmaps to influence policy and decision making. Previously mentioned, this is an interactive dialogue, so please feel free to engage with us. My name is Zanele Mabaso, and I'm with Girls Globe, and I'm also the PMNCH Adolescent and Youth Constituency Country Engagement Coordinator for the Advocating for Change for Adolescent Toolkit. So we will be using the hashtag #EWECYouth social media. Feel free to engage us on social media using that hashtag, as well as tagging us on the Twitter handles that will be displayed on your screen. So we will be interacting with the speakers. Their Twitter handles will also be highlighted on the screen. So let us get started, and also acknowledge that we have a chat box on the right-hand side or left-hand side of your screen that you can utilize to sort of share your questions or comments that you have when we are engaging in the webinar with our speakers. So feel free to make use of that. So let us go into the introduction and outline of today's webinar. So first, we will give you an introduction and overview on the toolkit. Then we will engage in a rapid fire session with our country partners and youth advocates, and they will be highlighting some of their experiences around adolescent and youth coalition building, mobilization, influencing decision makers for adolescent health and well-being. Thereafter, we will have an interactive discussion and Q&A session. Feel free to engage with us on the chat, asking your questions and posting your comments on there. And then we will have a wrap up and address some next steps. So let's go into how the toolkit was developed. It was developed by PMNCH in collaboration with as well as the members of the Adolescent and Youth Constituency with other technical partners. The toolkit was first launched at the Canadian Partnership for Children and Women's Health Conference that took place in Canada in May 2017. We had a 2.0 version of the toolkit that had updated with some country case studies and information on how to engage in the GFF. And this was launched at the Partners Forum in December 2018. We have some pictures on there as you from some of our engagements when young people were launching the toolkit. The first one in Ottawa in May 2017, and the other picture displaying the pilot that was done by youth networks in various countries, such as Malawi, in November 2016. So the toolkit for adolescent toolkit developed by young people for young people, and it's a practical guide that provides young people and youth networks with guidance on how to design, implement, and monitor an effective national advocacy roadmap on adolescent health and well-being. And it aims to encourage meaningful engagement with people and drive that positive advocacy and accountability efforts to influence national plans and processes. As you can see, this is the cover of the Advocating for Change for Adolescent Toolkit. And the updated version is dated December 2018. That's on the next slide. So the toolkit is comprised of about 100, but because it includes all these case studies and best practices from our country partners has done, it has a lot of pictures as well as exercises that young people can engage on to work on their advocacy roadmap. So if we go through the steps, the first step through highlighting how to get ready for action. So it takes through a process of understanding adolescent health and well-being. Then the second step looks at gathering information on national policies, strategies, and plans. So this section of you to look at what national policies exist in your countries, what strategies exist, and what are some of the country level plans and commitments that have been made by your government to in health and well-being. And looking at these instruments, young people and adolescents that are trying to develop a national advocacy roadmap on par with the national commitments being made. And the third steps looked at looking at the global commitments that have been made to improve adolescent health and well-being. And this shapes the knowledge that young people should have around the global commitments that are being made. So questions as what are the global commitment mechanisms that are in place and how are they used, and sort of connecting those global mechanisms to local processes in order to accountability at country level. Then exercise 4 or step 4 of this toolkit looks at developing an effective advocacy roadmap. So this takes you through the practical steps that you need to look into to set up that advocacy action roadmap for the activities that you can implement on the ground with adolescents to make sure that they are aware of the adolescent health issues that are happening in the country and they're able to engage government and key stakeholders and make recommendations that can lead to policy specific changes around adolescent health and well-being. So some of the examples on there are looking at setting goals and objectives to accomplish for the advocacy, as well as mapping who can help adolescents creating that advocacy roadmap to achieve those set goals and objectives. Setting targets as well as indicators that can let you know if your efforts have been successful. And then the last step on the toolkit, that fifth chapter, focuses on the reviewing, monitoring, and acting for better results. So after we have gone through the process of understanding what adolescent health and well-being is in the country, and then looking at the national policies, the strategies, and the plans, and link them to the global commitments and mechanisms on adolescent health and well-being to assist us in developing an effective advocacy action roadmap, the most important step out of it all is to ensure that we are able to review what we have done, as well as monitor and evaluate the progress that we have made. So that is what the last step focuses on. And that also assists you in ensuring that the efforts you are working on are sustainable and that you are able to re-strategize and reframe your work and proceed with the implementation. Great. So how does PMNCH support youth networks? So PMSA supports youth networks at country level and provides seed grants of between 15 to $20,000 per year to strengthen national youth coalitions for a common voice for advocacy and accountability. Need to adapt the tool at a country level. So some of the examples that our country partners that you will be meeting have adapted global toolkit by creating country products, the music video, and country adapted toolkits with support from the decision makers. Result, our country partners host national events with decision makers, those toolkits in their country. And thirdly, we support youth networks in countries by building young people's capacity in advocacy based on country and case studies. Picture on the slide of the Kenya national launch by young people where they collaborated with their country level key stakeholders and government to launch their country context or country adapted toolkit in March 2018. So how does ACH continue to support these networks in countries? So as a continuation from the previously mentioned items, we also assist with developing national advocacy and accountability roadmaps with young people's networks. Going on the latest evidence, the policy making, and opportunities to engage in decision making. For example, we have the Global Financing Facility, otherwise known as the GFF, that people have been engaged in to hold decision makers as well as work together with them to map policies. We also work with youth networks in countries to advocate to national policies and sub-national programs so that we are able to assist the youth networks to meet their special needs and amplify their voice by using platforms such as social media and speaking high level events, because we know that when we allow young people spaces and platforms to engage with decision makers, then that will be able to be heard and sort of incorporated in policy making. Lastly is to monitor progress, and youth networks then adapt their roadmaps as necessary to maximize that change. And we have an example from Cameroon. They engaged with school counselors in Bameda, one of the counties in Cameroon, and they had a really successful with key stakeholders they are working with. So I will take you through a process of understanding what our youth advocates from the 5 different countries mentioned herein, Cameroon, India, Malawi, and Nigeria, are doing. So as mentioned, in order to have a really effective advocacy action roadmap, you want to have a goal and specific objectives to work towards. And these are the visions that they had. So first for Kenya, they were exploring expanding access to information and services to prevent unintended pregnancies and ensuring girls can complete their secondary education. Cameroon is working on disaggregating data for informed, tailored policies and programs for adolescents and piloting a comprehensive sexuality education program. They're focusing on reaching adolescents, on other empowering adolescents to meaningfully engage in the National Adolescent Health Program that they developed. And Malawi is mobilizing their networks and campaigning to remove barriers for access to services. And that is in line with their National Youth Friendly Health Services strategy. And Nigeria are working on advocating for increased finance for adolescent health and well-being, including RHR. Well, now that we have a picture of their broader focus, let us meet the speakers. So first we have Michael Asudi. Michael is from the Organization of African Youth in Kenya. Maziko Brook from Maziko Matemvu, Her Liberty in Malawi. And then we have Toyin Kudozi from the Education as a Vaccine in Nigeria, followed by Desmond Nji, Cameroon Youth Network, speaker from the YPE Foundation in India. So we will start off with Maziko. And it is really crucial to bring together a diversity of young people to mobilize around health and well-being. Maziko, how have you mobilized young people across the country to engage in advocacy, particularly in districts? How have you mobilized marginalized youth, especially disadvantaged and illiterate youth?
So much, Zanele. I hope you can hear me.
Yes, we can hear you, Maziko.
All right. So here in Malawi, we have been mobilizing adolescents and different young people affecting their well and health. And we had rebranded the advocacy toolkit to Malawi, which is Youth Engage on Adolescent. We did I mentioned about 1,000, over 4,000 adolescents and strengthening CSC and SRH messaging. And the first thing we did was creating partnerships with the district structures and acknowledging the district structures who also helped us identify young people in hard to reach rural areas, so that pretty much we didn't just wake up and say, oh, let's just work in that area, but we had to consult these structures to help us identify catchment areas where we could make an impact. And obviously before to a community and having activities, as great as your initiative is, as great as your approach is, you really need community buy-in. So it's very important to work with different stakeholders at the district level, which is what we did first. Now, the second most important thing is to meaningfully engage young people to take ownership of the issues affecting them. So we're always hearing young people as token, just pretty much being used as. So it's important to meaningfully engage young people. That means having them co-develop activities, having them take lead and ownership of the issues affecting them. So it's very important to not impose things on them. It's very important for them to take lead and tell you how they want. It's important to listen as well, because they know what works best. If you're going to impose how to work, if you're going to impose on activities and approaches, they're not going to take ownership of those, of the initiative or whatever you're trying to do. So what we did with our with the initiative, we pretty much had developed drama, it's not fun to people. And also it's very, when we talk about meaningful youth participation, it's not people co-develop, but also having them. So we also had young people with we monitor, but really engaging young people to take ownership of the issues affecting them. And also,
If I can, that you double check your mic as we seem to be losing you.
okay, Zanele.
Oh, I can hear you now. Can you? To get Maziko on the line again. She was talking about the importance of meaningfully engaging young people and ensuring that their participation is also meaningful, that they are able to obtain ownership of issues that are affecting them. Let me just also remind all our participants here to please mute your mics unless you are speaking, just to avoid any challenges and background noise, and also make use of chat box on the left hand side or my right hand side of your screen to ask us any questions and engage with the speakers. Also, social media handles are displayed on the screen, so feel free to engage us by social media as well. Maziko, are you on?
Yes, Zanele. Yes.
Maziko?
And we need to be creative and hello.
Maziko.
So I think when you're working with adolescents, you need to really keep in mind that these are young people. You're working with young people. You can't have the generic way of doing things. Young people don't like boring things. So it's very important to be creative. And as I was saying, we do fun approaches. So pretty much music, sports. We developed advocacy toolkit that were we used a short film, we used music, we had different community gatekeepers. As I said earlier, it's important to have community buy-in. And when this community, as much as you want to reach out to adolescents, you have and have in mind that community gatekeepers are very important and you can't negate them. So one of the creative approaches that we used was integrating those community gatekeepers in our interventions to reach out to young people in hard to reach areas. And so obviously that community also endorses your initiative. And we had intergenerational soccer teams, so we had like traditional leaders, religious leaders, young people just play together. And that was to also to strengthen transformational and intergenerational dialogues. And also the other thing is pretty much to leverage on existing networks and structures. You know what, your whatever you're is really not as unique as you think it is. Like somebody somewhere has already done that. Somebody in your community is probably doing something like that. of completely working in isolation and starting something from scratch. It's important to leverage on existing structures and networks that you have in your community. So, for example, here in Malawi, we have district youth networks and traditional authority networks that are platforms for young people and young leaders to advocate on issues affecting adolescent well-being and health, the well-being of young people in general. So leveraging structures like that, and also how we reach disadvantaged young people. We have in-school youth clubs. So these are youth clubs for young people go to school. But then we also have out-of-school youth clubs. So these out-of-school youth clubs are usually neglected because these young people live in hard-to-reach areas. We pretty much strengthened and worked with 80 out-of-school youth clubs. So that's the same thing that I'm talking about, leveraging on these networks and revamping these networks and strengthen with the district health management team, which is pretty much what I had said earlier, that you have to create community buy with district level. So these people will help you identify networks. They will help you identify catchment areas you need to reach out to. So for example, because of the partnerships we had created, we were able to reach out to young people who live by the borders, and they don't have to sexual reproductive health, and they don't know their rights, and because they live far away, they're often neglected. So we were able to identify the young people who stay on top of mountains. We're able to reach out to them because of simply creating partnerships, leveraging on existing networks. Because when you start to create those partnerships and you start to create those partnerships, it's easy for you to achieve whatever you want to achieve, especially with regards to advocacy and advocating for adolescent well-being and health. But that is pretty much it. So leverage on existing networks and structures. Be creative. Create partnership. Yes. Thank you.
Thank you, Maziko, for highlighting how you went about to mobilize young people at country level, as well as working with them on the ground at district level, sharing the creative steps that you took to engage those young people meaningfully and addressing adolescent health and well-being in Malawi, and also not leaving the key stakeholders behind, like and other community members. So now, as we are talking about the mobilization of young people and engaging them in different ways, we are now living in digital where technology is used to galvanize people towards a cause. Michael, take us through how you made use of online digital platforms and social media to engage young people and build those key partnerships with key stakeholders.
Hello?
You go ahead and engage us. We you.
Can you hear me? You can hear me? Okay. Yes. Okay. Thank you so much. I'm Michael from Kenya. I coordinate organization of African Youth. One of the grantees, PMNCH grantee on adolescents and youth constituency. And also one of the implementing partners for the Advocating for Change for Adolescents Health and Wellbeing Kit. Organizations. And we realized that after the customization, we needed to disseminate the toolkit and also make young people aware And before we started the dissemination, our focus was on how best to start talking about the adolescents' health and well-being. While in Kenya, there's been a lot of discussion on youth issues, and we realized that adolescence was a forgotten lot. That was as early as 2016. Most of the adolescents are always in school. They rarely get sick. When they're in schools, they don't also go to hospitals because most hospitals close during the evening. So we wanted to start that conversation on adolescents, and Kenya just in 2015 launched adolescent sexual reproductive health policy that defines the challenges and issues affecting adolescents. So using digital platform, this was one of the opportunities that we used. So we started using the hashtag of adolescent health KE, and also writing on the MNCH hashtag on youth, that is for every woman, every child. So through social media, we have been able to use it as a means for amplifying youth voices, and we've used different platforms. That is on Facebook. We've also used Twitter and the closed channels, that is the WhatsApp. We formed a WhatsApp group of around 15 youth organizations that we worked with in disseminating the toolkit and also customizing it. So how we've used social media mainly is first of all to mobilize the youth voices to start talking about adolescents' health and issues affecting them. And there's been more focus on teenage pregnancy, but there are also other issues like mental health. There are also issues around school dropout. There are also issues affecting adolescents, such as non-communicable diseases and also road accidents that were highlighted in the toolkit. So we've been able to use these platforms, first of all, to amplify and also consolidate the youth voices and also consolidate effort. We made it a deliberate move to use social media to document our work, such that if you track that hashtag, you're able to see from the launch of the toolkit in March 2018, the whole work is documented online that somebody can see and track and see the gains that we've made. We've also used the digital platforms and technology not only to galvanize voices of young people towards action, but also to use it as a tool for that visual connectivity. Because if you take the photos of the real, through that we realize we are able to build relationships. We have now we call silent followers. If we do the social media analytics, we realize that in as much as many people may not react online, but there are a lot of followers, people tracking our page, and people always going to our Facebook page and Twitter platforms. Then we also realized that we've used digital technology to tailor make messages that are relevant to different stakeholders. So sometimes we don't just tag government when there's need to change some policies. Like now we are revising the national youth policy. Then we also have the tailor-made messages for young people to let them know there's an activity taking place. And then through WhatsApp, that is really promotes personal connection of the advocates. We have various WhatsApp groups for different advocates handling different activities. So through this, we are able to share even the link where they can get the toolkit, use it. So many have confessed that the toolkit has helped them even beyond health. We have a group on environment that use the toolkit in planning the activities. I think the other big impact of technology in galvanizing people's voices toward a cause is on raising voices. We all know that there's a lot of challenges in the CSO space sometimes, and talking may not be a big issue, but through social media, young people have been able to raise their voices And in Kenya, some actions have been used as a tool for raising the voices and challenges facing the young people. We've used it as a tool for interpersonal communication that promotes acting. I think in many African countries, government engagements and timings are always very on short notice. It could be told that there's a very crucial planning meeting or a budget meeting, hearing meeting for public participation. But through WhatsApp group, we have been able to share these critical documents and also the timing and opportunities that young people can use to engage strategically with government. Then the way I said, the advantage of WhatsApp is that it's a closed group that you can use. So we have used WhatsApp as a tool for planning and strategizing before we engage. So we discuss a lot, share a lot of information in that safe space. And young people now have been able to use the Facebook. So we have been able to train them on how you can use, even hold meetings through WhatsApp. Most of the planning meetings for the toolkit and the rollout have been planned not physically but through WhatsApp, where we agree on a particular time, and that has helped us to handle the issues around digital. The need not to meet physically, but also being able to meet online. And then the advantage that we've also had for using technology is that we are able to show the government that many people are talking about these issues. For example, currently there's a lot of discussion on menstrual hygiene, and young people have also gone online. So showing government that there's a discussion going online and what can you take about it and what do you think about it has been also a platform. Then when we are doing consultations, we manage to use very simple tools like the Google form to collect views of young people on how the Kenyan product, the toolkit, should look like. So we managed to share this through different platforms and got very rich inputs on various issues affecting adolescents and what should inform our toolkit. We are able to reach around I think 30 organizations across Kenya, just filling in the Google form. So I really recommend for many youth organizations to use maybe SurveyMonkey or Google Form as a simple tool that is cost free in also getting their voices and getting as many young people's inputs as possible. The advantage of this, we've used it as evidence to government on the needs for young people without editing, and it has also the timestamp. It can show when this was filled, and it can be easily tracked without saying that are you on whose behalf are you presenting these issues. So just pulling down a filled Google form has been a really good evidence for us to use in our advocacy. And on building partnerships, I think through strategic use of social media, we, as an organization, we've been very much able to develop partnerships. So many people are approaching us that we see you do this online, we can see your work, we can track what you're doing, but how can we partner? So through that, we have several organizations who have asked to use the toolkit and we refer them and we use them. So I think social media is really a good tool, especially analyzing the audience and silent followers will always email you. So I really recommend if you use it, also leave some contact details for the silent followers to give you. So in summary, I would say there are challenges in social media, especially small thing can make the whole message go off. So there's need for basic training of everyone to know how to handle social media. And then it comes also with the responsibility, so framing the messages. And then above all is persistence and consistency. So you'll most likely have people unfollowing you or disliking your page and liking your page if there's no consistency, and then also if the persistence does not there, and then also if you lose track on the messages that you are giving, so it really need to be focused and very rich. So if you look at our Facebook page, we rarely update it because we realize many people don't like populated Facebook posts, but on Twitter we have many posts. So those are some of the opportunities that we have. And since we started the toolkit, when we track the hashtag, we now have around 500,000 impressions. Thank you.
Great. Thank you so much, Michael, for really addressing how you've been involving young people on online digital platforms and social media, taking us through that process that you went through to build key partnerships with key stakeholders and sharing some of those tips for young people who are listening in on this webinar and some strategies that you can adopt to effect key stakeholders on digital and online platforms. So perhaps let's move the discussion more to engaging the decision making, the processes that were involved, thinking the toolkit and the advocating for change for adolescent roadmap to makers and stakeholders in the country. We do know that when it comes to youth-led advocacy, it's important to cultivate relationships with makers and sort of get your message across effectively. So our next speaker, Souvik from the Foundation in India, you're next, and we know that you've worked with government and you've engaged key decision makers and policy makers alike that you have been doing in India. What are some of the steps that you took to get government on board? And what are some of the best practices that you realized when working with decision makers and policy makers to engage adolescent health policies and programs meaningfully?
Yeah, sure. So hi everyone, and thank you, Zanele, for like setting up the context in which what we have been working on. So India being a very big country where we have 253 million adolescents current, we got this opportunity to use the toolkit. We at that really had a clear long-term vision that this needs to be incorporated into the national program. So in 2014, the Indian government had launched a program on adolescent health, specifically targeting on different thematics of adolescent health, which is inclusive of the sexual reproductive health, nutrition, substance misuse, gender-based violence, mental health, and also issues of nutrition and NCDs also. But the program also had a component of involving adolescents as social agents of social change. Though it was in the policy document, we knew, and the implementation phase, it was not that great. Like they have were being bombarded with a lot of information, but not really getting a chance or their skill building happening so that they can inform the government or inform the health officials or what are their challenges and how actually the program can be best run to affect their lives more positively. So from that perspective, we started to think of what would be the best strategic entry point to set up a partnership with the ministry and then move forward with it. And very thankfully, and very fortunately, also there was an international conference happening, the IH World Congress on Adolescent Health, and we utilized that opportunity to kind of partner with the ministry and make that global toolkit into a national product. So that was our first step to, our first foot in the door with the ministry. And PMNCH has been very supportive in this effort so that we could develop a national product in partnership with the ministry. And that ensured us we have a toolkit which is co-developed with the ministry. So the ministry now also has an ownership towards the toolkit for its implementation. So while this happened, we parallelly also moved forward towards like how to best implement it at the ground level. So also one of the, in the conversation also I want to bring in like the challenges of working in a big country like which operates in a federal system, that though the policymakers sitting at the national capital might be supportive to your issue, the implementers on ground may not be aligning with you. So their priorities might be different. So while we developed the toolkit and were advocating with the central ministry, we started rapport building with the implementers also. So they were also laden with a lot of challenges because a lot of other programs competing priorities. And in that space, we also tried to reassure them that we would be coming support, and actually the program, which is not maybe moving great forward with more adolescent or young people's participation into the program, will actually be a strength for you and it will move forward. So this kind of rapport building we parallelly started doing, and also with other stakeholders like other UN agencies, other grassroots organizations who work on issues somewhat connected to adolescent health also. We try to make them understand how intersectional these issues are, how interconnected they are, and these can be good leverage points to enter into a government partnership and engage closely the government into doing this kind of work. So while these two were happening, we also knew that often it happens that from our that government or health officials quickly say, okay, like if you want young people to be into the process, bring us young people, we will just engage them. So we knew this would be coming. So we were parallelly also training young people so that they understand the vocabulary and the language in which these government people operate, so that like their participation do not become tokenistic or like government people being preachy about them that okay, like you need to do this 1,000 things, but they also know very well what the government is also supposed to do, what are their entitlements, where the government is failing, and where they can pitch in their support in making the implementation of the work better. So these were the three main strategies I would say which helped it kind of concretize our relationship with the government, as in like the first finding this right kind of strategic entry point to bring ownership of the government into the process. Second was a rapport building with stakeholders at multiple levels, just not with the decision makers or the policy makers, but also with implementers. And third was capacity building of young people, and then create engagement platforms of for these young people with these stakeholders, including government agencies, so that the young people are more capacitated and will be able to on the work pretty soon. So these strategies really helped us in making this toolkit a great success, and now we are moving forward with making more simpler workbooks out of this toolkit, and we would be going to implement in different parts of the country. And this is going to happen in partnership with the Ministry of Health and Family Welfare, just not at the central level, but also at the district level, at the state level. So it's the ownership towards this toolkit is slowly we have been able to develop across multiple levels. So that has been the really great. We are hoping that this model will be pretty successful, and it might be incorporated into the whole national program, and then only it will be actually reaching to the large population of 53 million adolescents. And well, that's what our long-term dream is, and we are trying for that. So
strategies that you have shared, Souvik, of engaging decision makers and sort of cultivating those strong relationships with as policymakers alike in the implementation of the tool. So as we move to our second last speaker, which is Toyin from the Education as a Vaccine in Nigeria, let me remind you all on the webinar to utilize the chat box on the left or right hand side of your screen to pose questions and comments to our around experiences that they have shared on implementing the rollout of advocating for change for adolescent toolkit in their country and general experiences they have gone through in their journeys of youth-led advocacy. I hope you've been listening attentively and are really excited to engage our speakers when we have the Q&A later on. So there is a global financing facility, also referred to as the GFF, and it is an important platform for young people to engage meaningfully in decision making at country level, particularly to investments in the health of adolescents. Toyin, how have you been able to engage decision makers on various platforms, including the GFF in your country, and ensure that young people have a role to play and their involvement was prioritized so that their voices were heard on such platforms? Take us through that process, please.
Okay, thank you, Zanele, for the question. For us in Nigeria, we identify that the financing facility is an important vehicle that can impact adolescent health in Nigeria. It can make a positive impact on adolescent health in Nigeria. And we know that for us, Nigeria has made some progress in joining the global financing facility. And back here has also institutionalized policy that would help implement that here in Nigeria, which we're calling the Basic Healthcare Provision Fund. This fund is supposed to be for states, is going to be implemented at state level, makes it possible for states to determine how they can spend the money and channel the funds, towards different areas of health. So for us, we've looked at the operation manual for the fund and analyzed it and looked at the entire process to identify in what ways young people can meaningfully engage in the process. And we have, from this, developed clear advocacy asks and goals, which is important so that when we are engaging decision makers, it is clear what we are asking of them to do. And so we've also done like a stakeholder mapping to identify who we want to engage and who is important in this process that can make a change or influence a positive change. And we also identified what exactly we want each of the decision makers to do. The Advocating for Adolescent Toolkit is an important tool that has helped, to carry out the stakeholder mapping. And so from then on, we have made recommendations based on the analysis of the documents, the Basic Healthcare Provision Funds Manual. And with these recommendations, we then engage the policymakers in face-to-face meetings. I would like to just add that it's important when engaging policymakers to come with some form of evidence. So the information from the analysis and also information from other global commitments, that Nigeria as a country and in any other country signs on to, is also some to add the evidence that we're presenting to policymakers for them to make investments in young people's health and well-being. So for instance, we have identified the level at which this fund is going to be disbursed and implemented. And so we've advocated for young people to be part of that process of monitoring at the ward levels, which is like the lowest level of the lowest unit of governance, the communities. So at that ward level, there's a ward health committee who would monitor the process, the funds and how it's being used. And we've advocated for adolescents or young people to be part of those ward health committees so that they can monitor expenditure as it relates to adolescents and what they are spending, and if they are actually doing what they should do. It's also important in terms of, like I said, the accountability. And so these recommendations that we have made, we're utilizing it during advocacy visits to the different stakeholders that are in the GFF in Nigeria. We've engaged with the Ministry of Health, the different the Family Health Departments in the Ministry of Health. It's the unit that is in charge of the Basic Healthcare Fund. We're still in conversation with them. The other gateways that are involved in the fund. Another thing that we've done is that we've also utilized other spaces where we come in contact with these decision makers and policy makers involved in the GFF to have with them, brief conversations about the issue of prioritizing adolescent health and well-being. We've also used those opportunities to also for actual planned meetings with them to further discuss, these issues. It has also been very important to leverage allies and champions for adolescent health in Nigeria, to speak up for us too in other spaces where we are not present, and also to support us in engaging with the actual decision makers who have the power to make the change. I also believe that social media, just like the previous speaker had mentioned, is also an important way of engaging with policymakers to, move them to make change. So we have also use social media to engage the policymakers. We tag them when we make those tweets or on Facebook, on other platforms, to say this is why it's important for you to invest in adolescent health. This is why it's important for the GFF to be to prioritize adolescent health and well-being, including their SRHR. And through all of this process, it's a young people's led process, because we have also trained young people in this too. It's a little bit more clear to them what the objectives are and how we want to go about it. And they're part of the process, from start to finish. That's like how we have been doing it, around the GFF and other platforms. Thank you.
Sharing those concrete examples of how you have been able meaningfully engage people in global decision-making mechanisms such as the GFF, and ensuring that their involvement is prioritized and that decision makers and policymakers alike recognize young people's importance in being involved in such decision-making processes at country and sub-district level. So now let us move on to our very last speaker, and that is Desmond Nji from the Cameroon Youth Network. Please, once again, if you're on the webinar, feel free to engage our speakers on social media. The hashtags and social media handles are on the screen displayed in front of you. Utilize the hashtag #Youth to engage us on social media, and also make use of the chat box for any questions that you might have listening to the experiences our youth advocates are sharing on the Advocating for Change Adolescent Toolkit their country. Now, let us move on to some key lessons. Comprehensive sexuality education is an particularly important, and it requires gathering inputs from young people themselves and working with various industries. So, Desmond, what are some of the lessons and challenges that you have come across around working with young people and government meaningfully, particularly in your work with comprehensive sexuality education?
Thank you very much, Zanele. Hello, fellow young people. It's a pleasure to talk to you about what we've done so far in Cameroon. To let you know that in Cameroon, there are over 4 million young people living in the country. It's quite a huge population, and their health and well-being is it's very important for policy makers to consider. However, comprehensive knowledge in HIV, this is just one of the sexual and reproductive health information that is required. This information among adolescents is quite rare, with just about 25.7% of boys, 25.7% of girls and 29.8% of boys aware of their sexual and reproductive health, including HIV. So this data is actually quite troubling, and that is why the young people from various organizations in the Cameroon Youth Network had to do a problem framing that develops the project which we are running at the moment. And so we actually run the project Advocating for Change for Adolescents, which we dub as ICAP. The completion of phase one of this project led to the development of 3 tools, which we term as the Adolescent Health and Wellbeing Package. And it consists of the ACAP Toolkit, that is the global toolkit which we are referring to, that has been adapted in Cameroon and translated into French, because, as you would know, the country speaks French and English on an official basis. So we did this by engaging government officials together with the young people. We also did develop a comprehensive sexuality education manual for teaching sexuality education in secondary schools, and we did develop disaggregated data or information tool to help collect information about and well-being of adolescents, especially when to adolescents in secondary schools. All of these were accomplished thanks to the meaningful engagement between young people and government officials. At this juncture, we would say that the young people had the young had the knife, in engaging the young, government officials. That's why I actually enjoined us who are attending this call today that if government officials aren't engaging us, let us engage them, especially when we have the opportunity to do so. And so in the course of this, we have a lot to share as concerns lessons. So I tried to make this in the form of an A, B, C, D, E, F, G kind of lessons, which we can learn from what we did in Cameroon. The first thing is we had a strong case. A stands for a strong case. So ACAP to us looks like a social venture. And how did we come out with it? We actually sat down and we did a problem framing and decided to pin down on something which is feasible, which is attainable, which is quite smart to achieve. Identified the inadequacy of disaggregated data on adolescent health and well-being. There is data, there is some data though, but it's good to disaggregate it according to age, region, sex, what have you, because adolescence is not as homogeneous as we may think. We have young adolescents from about 9 years to 12 or thereabouts, and we have older adolescents from 12 to maybe 19 or 24 years, depending on what definition you use. So this is quite important. And secondly, comprehensive sexuality education is limited, and that explains why there is a high rate of teenage pregnancy and limited knowledge on HIV and so on. So do find a strong case which encapsulates all what you do. So apparently everything we do concerning the project revolves around expanding CSE and disaggregated data. Once it is clear to policymakers, so they understand what you are looking for, they understand what you're advocating for, and they can best help. B is be meaningfully engaged. First off, ACAP is a good example of meaningful youth engagement. As I said earlier, if officials aren't engaging us, we should go out there and engage them, because we had the support from darling PMNCH supported us to engage them, and we did engage them. So it's actually important to build this kind of win-win partnership between government and young people. So when you have the means, do engage the officials, let them be part of the process, because at the end, they are the ones to finally formalize the tools that will be produced. C is consider hard work. It's not been easy, but you need to put in some more effort in there, to make the work look good in the eyes of many. So we leveraged our professionalism in the work we did and we're doing, and are enjoying you as well, for you who will be carrying out projects in your communities, to also do the same. Once officials see your seriousness, your hard work, I think they give you a lot of respect, and they know that what comes from you is something that has been well thought out. D is don't quit yet. The delay or non-response to that email that you send shouldn't deter you in any way. Government machinery, it's said, moves rather slowly, but someone has added surely. So do press on, do keep on checking, and if you're not getting a response, find someone who can respond to you. So don't quit too early, do not zap, remain on track. E, enjoy networking. Find those officials that will help you and talk with them. Meet them internationally, nationally, locally. Find out those meetings, you can catch them and talk with them. If they want you to wear good clothes, wear it and speak to them. They would listen to you, and they want to see the passion in your eyes and to know that you're actually passionate about something useful for adolescents. They're going to help you. F, finish the good work. It could be easy, not easy sometimes, but it could be easy to start something good, but later on not finishing it, and which is equal to not doing it actually. So it's worthwhile that work started well should also end well. It may be done in different ways. For an advocacy project, for example, you can try to ensure that the outcomes are attained, and you can monitor and track all of these using a monitoring and evaluation toolkit. G is get involved with the GFF. Well, this concerns the GFF countries. As you know, Cameroon is one of those countries, and we've striven to align what we do with the GFF focus, which is actually quite well articulated there, because the GFF works to strengthen comprehensive sexuality, comprehensive sexual and reproductive health services to young people in the territory. As of now, some young people are aware of the GFF, but the technical aspects that guide meaningful engagement is still lacking. So we look forward to working on this aspect in subsequent projects. And however, in this phase, that's the current phase in which we are, phase 2 of ARCAP. When it comes to disseminating the device toolkits, we shall build on the CSO coalitions in the GFF to facilitate this process, so that we get that, we nourish that alignment there. All of this is not done without challenges. There are challenges we faced, which are somewhat common among advocacy projects everywhere. So we have these challenges, and I also propose some remedies or efforts we put in place to sort them out. The first is we had a very large network, and it was sometimes daunting to really galvanize talents across the country and to put them down to work on the project, because it actually entailed thinking, working, and doing things. So we separated the network and the broad stakeholder committee into 3. So we had a larger stakeholder committee, which involved just everyone who has anything to do with the project. And then we have the reference stakeholder committee, where the committee involves members who can review first-hand proposals that we make. And then presently we have a task force that is working hand in hand to ensure that the project, the day-to-day aspects of the project, go on smoothly. And all this team comes from different organizations belonging to the Cameroon Youth Network. The second is we've had slow response from government officials, which is quite imminent. If you're going to carry out an advocacy project, you can expect this. So what we did was we meaningfully engaged them. Sometimes we also cut the hierarchy ladder and we move up to the top. And I'll advise you to study the hierarchy ladder very well. Sometimes you might realize the person who is blocking the progress of your work is the gate man who is stopping you to go in and see the director. Sometimes you can bypass the gate man and move right up to the minister, and you find that things become very easy. Don't let anyone stop you from achieving your objective. Changes in government officials can also have a major setbacks on achieving projects. The thing is, the new officials need to understand where his predecessor ended, and take on from there. So hurry up and introduce yourselves.
Desmond.
Yes.
To cut you off, but really in the interest of time, I think we will have a round of questions to address some of the questions that you haven't when we interact with our audience. So thank you so much, Desmond, for those lessons and challenges once again that you shared, that you've experienced implementing Toolkit in the country. So we've heard from all 5 of our youth advocate speakers on the lessons and challenges and best practices that they experienced in implementing the rollout of the Advocating for Change for Adolescent Toolkit, and just their journeys in engaging in youth-led advocacy in their countries. And I think it's quite insightful and informative. So we looked at the mobilization aspects, and we looked at engaging decision makers and policy makers and bringing them on board to meaningfully engage with young people in addressing adolescent health and well-being. And then we also addressed all the existing global decision-making platforms and the importance of ensuring that young people's voices are heard. So let us now move to having a discussion and addressing some of the Q&As. We noticed that there's a couple of questions in the chat box. So I will take one question and I will allow our speakers to respond in perhaps allow, let's say, 3 minutes maximum per speaker to respond. And then we will move on to a second round of if we have time for that. So
would it be okay, sorry, to jump in and ask, I think both questions could be, can you read those questions in the chat box? See who would like to respond to those, but because in the interest of time, it would be good to cover both of them. And if you could read them, please. Thank you.
Thanks for jumping in. So for our panelists, we've got, so the first one is from Slovenia, an NGO organization called No. So they would like to know if you, well, they advocacy which is not easily supported by government because of industry influence on the lawmaking, and they wanted to know if any of our panelists have experience in addressing these issues with young people. So I guess with the first question, we can pose that to Desmond and Souvik, if you could share a practical experience with government officials at global and regional high-level events, such as the World Health Organization or UNGA, how you've kept them committed to supporting you once you home. Question on the chat box is from Terence from Cameroon. He thought it was a great presentation from Michael in Kenya, and he wanted to find out if the provisions have been made to provide assistance or train youth who are not able to actively use the different apps on social media and technology when using the toolkit. So for this question, we can pose that to Michael. Maziko, you can also jump in sharing what the most important thing people can be mindful of when engaging government in adolescent health, social media, the question, of course, different app media when implementing the toolkit. So let's start with Desmond and Souvik.
All right. Yeah, I think as far as that is concerned, the question is about young being supported by government in projects they do. I think in the lessons I just shared, you can pick out some bits from that help. I don't know, since you mentioned the law, it could be, I don't know if it's a legal framework that limits that support, or there is limited visibility for young people. But I suppose for both, you can make change by really engaging with the officials. Find them, meet them in those meetings. When you get invited to meetings like the global meetings where you have officials from Slovenia, find them, catch them somewhere, stop them, talk to them, and let them feel your presence, and things begin to work from there.
Desmond, let's hear from Souvik.
Yeah, I mean, I'll just be very quick in a sense. Like, I have a little experience of working on issues of mining industries, how they have been impacting lives of indigenous people to the country. It becomes very difficult for other ministries to step in into that process. But somehow, for one state in the central part of India, where like there have been other organizations, I have been part of that whole network, not directly leading it, but there were young people from tribal backgrounds and others also who kind of brought in the element of mental health, like how a mental health of a large population is going to be affected if the mining industries do not stop their deforestation and displacement and all of that. So that had garnered some more support from different civil societies, and mining industries had to kind of stop back. So it was a little bit more of confrontational in to some aspects, but it was also strategic to like move beyond the issue which they are easily able to trample down, that saying this is good for the country, good for the people. Well, this mental health element to that got the thing more catchy for many people, and many people swayed their views that okay, maybe this deforestation effort just for interest of mining industries may not be the best thing to go forward. So that is one small example I have, and there are networks in the country who are actually working on issues of alcohol use and issues of tobacco control and all of that. But again, like as I said, it's challenging to kind of health ministry to take initiative and try to block the economic resources which is coming to the country. So it like we have to find different strategic entry points. What most of that networks, again, I've been part of the network only, where most of the wins has been more at an implementational level rather than trying to make a major policy change, which becomes very conspicuous, and then other ministries also, like, it becomes very difficult. So for a country like India, it has been more successful to kind of block or able to make some like quick wins, achieve more at an implementation level. So yeah, that would be my response to this.
Fantastic. Thanks for that comprehensive response. And Michael, just really quickly, do you have a response for the second question from Terence?
Michael seems to have shared a response on the chat box.
In the interest of time, Michael has shared that you can find them on Facebook. We shared their handle, which is at Youth Kenya, on Twitter, and they can learn more about it. And you can also engage them by email. I think they will share their contact details in the chat box. So please reach out to for more information and any other person in the audience who wanted to find out about that. So that has come to the end of our session. So let's look at some of the opportunities that we have and the way. So how to get involved. So please check out the Advocacy Change for Adolescent Toolkit and share your feedback on the email that is provided on the screen, which is ayc@gmail.com. And we also have some announcements. PMNCH is launching a request for proposals to select youth networks in 5 additional countries to roll out the toolkit. So some of the eligible countries include Liberia, Ghana, Sierra Leone, Zimbabwe, and Zambia. To get the full list and more information, just visit the link that we have displayed on there. And also, coming up in a few weeks, please website, we have the request for proposals for a technical organization to manage the 10 countries. So this is the current existing countries from today, as well as the 5 additional ones for 2020 to 2021. And we also have an RFP for the campaign coordinator to design an umbrella campaign for adolescent health and well-being. We have some resources, and that the Advocating for Change for Adolescent Toolkit that we've been engaging on today, dated December 2018. It's available in English, and we will have it available in Spanish as well. Second, we have the Global List on Meaningful Adolescent and Youth document that is available in English and French on the PMNCH website. So coming up, next step is PH will showcase the blog series from our advocates of the they shared today, along with the policy brief advocating for change for adolescent toolkit in the 5 countries. So in closing, thank you so much for joining the web interactively engaging our youth advocates on the youth-led accountability and advocacy journeys in their countries. For more information about the work that they're doing, please follow PMNCH and also utilize the hashtag #EWakeYouth on social media, Twitter, and also visit the PMNCH website for more information on everything that's been shared today. Thanks again to our speakers, and we look forward to engaging you on other platforms.